Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly press conference on Delaware's response to COVID-19. I'm joined once again. We're coming to you again live in Zoom, and we appreciate everybody joining us this afternoon. We have some important information to share, some good news, and some concerning facts on the ground in our state. I'm joined once again by Dr. Karyl Rattay, who is our Director of the Division of Public Health. She brings with her all the team of folks in public health who've been doing an incredible job over the last 9 months and continue to do so in responding to COVID-19 in our communities and really helping us get through this public health ordeal. We also have Schall, who's the Director of the Delaware Emergency Management Agency, who's been instrumental as our point person with the physicians out at Public Health, standing up a very comprehensive testing program. You'll hear more about that. Just incredible numbers that we're putting up, AJ, and testing folks across the state of Delaware, and just meeting goals and numbers that I never expected that we would be able to meet. The very good news, the really good news is that we have the first vaccines were administered today in the state of Delaware early in the wee hours of the morning there at Bay Health Medical Center. One of the nurses there, the focus initially will be on these several thousand vaccines, will be to hospital workers, healthcare workers, first responders. There's a whole list of those. We've made available press information about the cohorts of individuals and the priority to which they will receive the virus. This is really good news because it'll enable us to vaccinate populations, those who are dealing with patients every day. One of the big challenges that we face, and we'll talk a little bit about that, is preserving our hospital capacity in hospitals across Delaware. It's a big issue. We have some time-lapse data that was shared by Dr. Birx. Ambassador Birx visited us earlier or late last week to share information about her trip across the country, visits with other states to underscore what's happening there and the way the different states are responding, and brought information to us that I think will be helpful as we work with our hospital to manage the capacity for critical care in their facilities, as well as to mitigate at the same time to reduce the prevalence of spread across our state while we administer and get those vaccinations out. So we'll be fighting COVID-19 on several fronts with heavy-duty artillery now, which has arrived in the vaccination. And we're delighted with that. And we appreciate Ambassador Birx and her visit and the expertise that she brought to help us and help our efforts with our partners in the hospitals to decompress and to manage the emergency populations that they're seeing. So let's go to our dashboard to start off. You can see now we're closing in on 50,000 total COVID-19 cases. We're up over 800 total lives lost, each one a precious one, with family and friends who during this holiday season are going to be missing that individual. One of the things that I mentioned a minute ago that we're very concerned about is the increase in the number of Delawareans who are in the hospital. You could see 41 new admissions to the hospital, 376. We'll compare that with what we saw in the spring in a minute, and you'll see the run-up that we've had over the last 2 months. 62 of the hospitalizations are critical. The hospitals report that the seriousness of the illness that they're seeing is not quite as bad as it was in the spring. They've got new ways of treating the patients that come in, and they're able to move patients through and then out into assisted care facilities, which we have helped them with through the state and through our private partners in the nursing home community. So let's look at each county. 27,000 positive cases in Newcastle County since the first case back in March. 7,200. Again, Kent County has the fewest number of cases as a percentage of their population, but they have the highest percentage positive in recent weeks, and we are encouraging our neighbors in Kent County to get tested, particularly if you've come in contact with folks in an unprotected way with mask wearing and social distancing, and closing in on 13,000 positive cases down in Sussex County. So if you look at the percentages now, we've changed, as you'll recall, we have two measures to determine the percent of tests that are administered that are positive. First, we have a calculation of the percentage of persons. So many people in our state have been tested more than once, but they're only counted once here in this percentage, and we're up to 22, almost 23% of persons having been tested or positive over the last 7-day moving average. So that's a measure over 7 days. And then well over our 5% target, we're up to almost 10% in the percentage of tests that are positive. And you need to remember, as we increase the number of tests that we're doing, we would expect and hope that the percentage would go down here. And of course, this percentage is leveling out a little bit, but we're still doing an increasing number of tests, which is driving part of that fraction, the denominator up, and meaning that there is continued spread across our community. And so you'll remember back in the end of the summer where we were concerned about 100 new cases per day on a 7-day moving average. We're 8 times that now, at over almost 820 new cases per day. So here again is the next slide is the comparison between the total persons tested. So of the 970,000 Delawareans, we've got almost 500,000 of persons tested. Now, some of the folks are people that have snuck in from other states that we obviously don't turn away and we test. And then of the tests administered, we're closing in on 900,000. And at the rate of, I think we did 50,000, AJ, in 1 day, 1 week, I should say. That's we're going to get to that 900,000 number of total tests pretty quickly. If you look at just some of the data, again, the rate of positive cases is still the highest among the so-called a young adult population. 18 to 34-year-olds is the top line there, and actually, the next demographic up, 35 to 49-year-olds, is increasing at a similar rate and closing the gap there. And obviously, that's concerning. We'll talk a little bit about the young adult group in a minute. To look at our other 14-day view on our data dashboards, you can see there on the top 2 graphs from the left corner and the middle, those are new hospitalizations, current hospitalizations on the far left top, which continues to rise to the total today that we mentioned, I think was 376. And then the middle graph is of new hospitalizations day to day. And so you want to see that declining as it is. And then you have how quickly can you move folks that have been admitted out of the hospital, getting the treatment that they need. New positive cases, as I said, are in a 7-day moving average over 800, which is many times above where we'd like it to be, and an indication of the prevalence of the virus in communities across our state. On the bottom level, in the bottom left, is the percentage of persons that are tested positive. That was over 22% today, and so it doesn't count those who are tested more than once. And then the percentage of tests that are positive, and that number coming in today, just under 10% with the 7-day moving average. So those numbers, we want to flatten that curve out, the number of new positive tests that come in each day, the percentage of those tests that are administered to start to go down. And we can drive that down by both preventing the spread of the virus as well as increasing the number of tests. I think we may be meeting our capacity on the testing side certainly will impact our ability to get the results turned around quickly. So if you look at the next all available data, so going back to when we first started collecting data in April, you can see the April surge in current hospitalizations. Hospitalizations curve there is a good one to compare the spring on the far left of that graph, top level, far left. As things improved, people moved out of the hospital, number of positive cases went down, percent positive went down through the summer, and then started to surge in October and November and into December. New hospitalization admissions, you can see at the beginning, we're getting a lot of folks coming in on a day-to-day basis, kind of fairly consistent through the rest of the time cycle there. If you look to the far right, new positive cases, clearly more on the far right of that graph, meaning more recently in October and November. But of course, we're doing considerably more testing than we were back in the spring, which explains the big difference there. Again, on the bottom level, the bottom left and the middle, you can see the percentage of persons testing positive. Part of the reason for the big numbers back in the spring is we just weren't testing many people compared to what we're doing today. And so you had a lower denominator there. Same thing for the percentage of tests that were administered. There just weren't as many for the number of cases. The good news, again, is we've got a data dashboard with your personal protective equipment that is really strong at the moment. And so we're ready with protective equipment for all those workers who need it to address the situation on the ground. So let's take a look at current hospitalizations, and you can see how the run-up happened here back in April and what we've just experienced in November and December. Back in April, we went from 167 in the hospital on April the 9th to the peak on April the 17th. I think it was a little after that, actually, at 337. And then we gradually went down as we stopped the spread of the virus and the prevalence in our community to a low of 29 in the middle of August. Things started to ramping up in October and really accelerating after Halloween, and then certainly a double dose there after the Thanksgiving celebrations and folks kind of letting their guard down. And you can see the run up in hospitalizations. We went from just over 100 the beginning of November to 300 the first week in December, to 338 a couple days later, and then a week later to December 13th, yesterday, to 376. And so you can see that we've met with hospital administrators on those their ability and efforts to manage that hospital population, because we know we don't want it, like other states, get to the point where hospitals aren't able to provide necessary treatment for those with serious COVID-19 condition. So the good news is, on the next slide, we had our first COVID-19 vaccination. Elizabeth Cote in the progressive care unit, nurse down at Bay Health. So she's a nurse that works in the hospital on a regular basis, and she was the first Delawareans first to be vaccinated with COVID-19. The feedback that I get from our hospital administrators is that they've had very positive response from their employees to the vaccination, and that's a good thing. So we did have the meeting with Dr. Birx, as I mentioned last week. She brought some really interesting slides in that showed and illustrated the spread of the COVID-19 virus across the country through September, October, and November. And I think it's a really good way of illustrating the spread that we've seen in every state. And you can see the spread in Delaware as well. So if the first slide there with the spread shows that back in early September, from September 12th to September 18th, these are admissions to the hospital per 100 inpatient beds by county, so across the country. And you can see that most of the country, you have some red spots in different areas, but most of the country is in a green or yellow-green, so the lowest categories of admission. As if you move from September to October, which is the next slide, you can see the red filling up. When you move from October to November, significant increase, particularly in the upper Midwest and other parts of the country. And then if you move finally to early December, the first week in December, you can see that just about every part of the populated parts of the country are lit up in red. Some of the unpopulated areas in the far west, not as much, but significant increase from September to current to our situation here in Delaware in December. And it's a good way that Dr. Birx used to illustrate the challenge that we have, which is to work with our hospitals. And we talk to hospital administrators and operational staff on a weekly basis. We had our call just yesterday to talk about the hospital efforts to decompress, meaning to open up facilities so that they can meet the surge of COVID-19 patients that they're getting. And the hospitals are taking steps to do that, to manage the surge and to preserve that capacity. You've heard me say before in these press conferences that our total capacity is from 400 to 500 and somewhere beyond that. And obviously the hospitals are opening up other areas in their facilities, not so much for COVID-19 positive patients, but for folks that they can move into those facilities that are having other health conditions. And part of the learning of the last 9 months is as we decompressed last spring, certain people were delaying treatment that they needed that made their condition worse later on in the summer and the fall. And we want to try to avoid that to the extent possible. The hospitals are reducing non-urgent procedures and surgical procedures, things that would keep a patient in the hospital taking up space that might be used for COVID-19 patients. They're also prioritizing elective and non-urgent procedures and surgeries to limit those hospitalizations for other reasons so that they can meet the surge. One of the things that Dr. Birx recommended in her visit here was to make sure that we're using monoclonal antibody therapy, which has proven to be very effective. Dr. Rattay is going to talk a little bit about that later. It's a really effective treatment. It's proven to be the case. The federal government has purchased most of those therapies from the manufacturer and then distributing to the states and to hospitals. And we've gotten some here in our state. And each of the hospitals are using those to treat patients that meet a certain criteria. So if you are a high-risk person with a pre-existing health condition, and particularly if you are 65 years and older, you may be eligible or a candidate for this kind of treatment. So call your doctor as soon as you experience any flu-like symptoms and make sure you get tested, because this therapy works best, and Dr. Rattay will talk about it when you get the treatment as soon as possible after the first symptoms are experienced. So this is a really important way to basically to save lives and to preserve hospital capacity at the same time. Many of us are planning on getting together with our families, and we'll talk about that in a minute. But we know, and one of the things that Dr. Birx pointed out in her visit, that they're seeing a lot of the spread of the virus in states across the country that is coming from young people, the young adult group, ages 18 to 35 or 20 to 35. Young people who don't have symptoms, or they have symptoms that are very mild, and so they're not taken very seriously. And so they're actually the ones that are passing the virus on to family members and friends that they're gathering with over Thanksgiving in settings in bars and restaurants and other places. So it's very important that we all take this virus seriously, and particularly if you are in a group like our young adults who are moving and very social with their activities. Just realize that you're vulnerable to your families and friends if you've been exposed to somebody. And the more people you come in contact with, the more likely you are to be exposed. And right now, there's just a lot of virus out there, not just in the state of Delaware, but across the country, as you could see from our maps and all the red that was on the map just a couple slides ago. With the hospitalizations and the surge happening in states across our country. So those of you who are in this category in every demographic just need to be extra careful when you're interacting with family members and friends. And so you may be planning on gathering over the holidays, coming home to your family. And if you're not, we would recommend against households mixing over the holidays. Make this a holiday season where you're waiting for things to get better in January and have a bigger party, a bigger celebration then. But if you are planning to come home to family, to make sure that you be particularly careful about who you interact with on that quarantining period before you leave wherever you're coming from and coming home, to make sure that you're not exposed to the virus and bringing it back to your family. Maybe use access to testing. Make sure you're wearing your masks when you're within that period where you might be infecting others. One thing that before we go on to Dr. Rattay that I'd like to just underscore, since today is the last day to sign up for health insurance under the Affordable Care Act to Marketplace, to do just so if you've become uninsured because you lost your job over the last several months, you don't have insurance coverage now, get covered today on healthcare.gov through the Affordable Care Act policies that are available. We have Dr. Karyl Rattay with us again today. She's going to talk about vaccines. She's going to talk about monoclonal antibody therapies that I talked a little bit about, and other issues on the public health side. Dr. Rattay, thanks for joining us again.
Thank you so much, Governor. So let me start today with some not so great news, and then I will talk about more exciting news. So I always start with talking about areas of concern in our state. And as I've mentioned several times, I've moved the threshold value as we've seen an increase in our state. So for probably the early 6-8 weeks or so of me picking out the zip codes that we were calling warmer spots or hotter spots, I was looking at zip codes that had case rates of over 150 per 100,000. So 150 was the number I was using before. Then I moved it to 250. Last week, I moved it to 500, and we stuck with 500 this week. You can see that much of the state is in blue, which means case rates in almost all of our zip codes across the state are 500 cases per 100,000 persons. So again, significant spread of COVID throughout our state. There's no area of the state that is untouched at this point in time. There are several zip codes, 5 in particular, that are over 800 cases per 100,000 people. So this week, and really there's no pattern to it. This week in Wilmington, we've got 19801 and also 19805. Smyrna also is elevated over 800 cases per 100,000 people, as is Frederica and Frankfurt. So again, no real pattern. Again, it just really goes to show that COVID-19 is really everywhere in the state right now. Now, we still do have lower testing rates in Kent County in comparison to Sussex and Newcastle County has the highest testing rates. So again, we want to encourage everyone in Delaware who is either with symptoms or who has been exposed to somebody with COVID or at high risk for COVID or COVID consequences, please make sure that you're getting tested as is recommended and when testing is accessible to you. So let's switch now to talk about some of the extremely exciting news. I mean, this is really a milestone, I think, in our lifetimes, a real time to celebrate the triumph of science, both on the vaccine front and the treatment front. We are so incredibly excited to have the vaccine here, the Pfizer vaccine here in Delaware, and to be starting to vaccinate our frontline healthcare workers. So again, it's a really exciting time. Let's go to the next slide where we start to talk a little bit more about some of the details. I'm pretty sure most people watching have been paying attention to the news to some degree, and you saw that this Pfizer vaccine went through key approval processes this weekend. On December 11th, the FDA gave this Pfizer vaccine an emergency use authorization to be able to have this vaccine administered. Then the CDC committee, which is called the Advisory Council on Immunization Practices, who's also been deliberating for months about these vaccines and this one in particular. We spent hours and hours over the past week looking at the studies, looking at the safety and efficacy, and came out with their recommendations on December 12th. And then we received our first vaccine here in Delaware at Bay Health yesterday. 975 doses arrived yesterday. And the rest of our 8,775 doses are going to be arriving tomorrow to the public health warehouse. And we're very excited about that. As soon as we get it, we'll be moving it out to the rest of the health systems in the state to begin to administer their frontline health care workers and really all workers who are at risk of, or most at risk of getting COVID through their occupation. So on the next slide, let me talk a little bit about the timeline, where we are right now in the week of December 14th. It has arrived. We're getting the rest of our week allotment at the warehouse. And so now we are in the beginning phases of 1A vaccine distribution. I'll dig into that a little bit in the next slide. Another vaccine, same type, the mRNA vaccine is, if you can go back to the previous slide, Moderna vaccine is now kind of on the same timeline as Pfizer, only a week later. So it's expected to go through its FDA review and then the ACIP review Friday and Saturday. Also very, very promising results, very effective. And a great safety profile. So it's expected to also be approved. So we've put in our first order for Moderna vaccine, and hopefully we'll be receiving then our second shipment of the Pfizer vaccine next week and our first shipment of Moderna vaccine next week. And then we'll continue to receive weekly shipments after that of both of those vaccines. So on the next slide, I want to talk a little bit about what we know about the Pfizer vaccine, the conditions of the emergency use authorization. This vaccine has been approved for individuals ages 16 and older. It's not yet been studied in children younger, so that's coming next. But for those 16 and older, they can get this vaccine. For the most part, almost no one should not get the vaccine. Now, currently, if you have COVID-19 and you are supposed to be in isolation, we don't want you to get the vaccine because we don't want you to put healthcare workers at risk. Same thing as if you're exposed right now, you should stay in quarantine and wait till you're out of quarantine to get the vaccine. Otherwise, there really aren't any current medical indications here in the US for you not to get the vaccine. Now, there has been some concern about a couple of individuals in the UK who had a severe allergic reaction to the vaccine. It's something that folks are looking into very closely. Right now, though, allergic reactions are not a contraindication, meaning if you have a history of allergy, that does not mean you should not get the vaccine. However, there are some folks who should check in with their doctor to make sure that they're making informed decisions. Pregnant and breastfeeding women. This just hasn't been well studied yet in pregnant and breastfeeding women, although certainly the value of getting this vaccine for pregnant and breastfeeding women is very strong. Same with people who are immunocompromised, like people on cancer treatments or people with HIV/AIDS. So you should talk to your doctor if you're immunocompromised. Again, you're also at high risk for COVID-19. So your physician is very likely to advise that you get the vaccine, but also will provide you with some special counseling about some things you need to pay attention to. For people who have allergic reactions, even to other vaccines, you still should get this vaccine, but you should talk to your doctor about it. You want to make sure that you're getting your vaccine in a place that's equipped for serious allergic reactions, just in case that happens. Want to also make sure people know that both these vaccines require 2 doses. For the Pfizer vaccine, you should get your second dose about 3 weeks after. Now, it could be 17 days after, or it could be anytime after, but ideally you shoot for around 21 days after. That's going to make this this vaccine the most effective if you can get that second dose as soon as possible. So on the next slide, I want to just mention that we know that second doses can be hard for people to remember to get back. So for those who get their vaccine at this point, they'll get a card that has the information about the vaccine, and it tells them when they'll need to come back. But they'll also get reminder letters, as well as we're working on either phone calls or text messages as well. So we want to make sure that people know to come back and when to come back to get their second dose. So let's talk about the side effects, which is really important for people to be aware that there could be side effects. Side effects from vaccines are not uncommon. And so it's important to recognize that headache, fatigue, muscle ache, even fever, chills, and injection site soreness, sore arm, where you get the shot, can happen. It's not uncommon. They certainly don't occur in everyone. And what the studies have shown is it's more common after the second dose. Most people don't really have side effects after the first dose. But again, they're very mild. In general, could be treated with ibuprofen or acetaminophen. They typically go away within 24 hours. So for the most part, don't require medical care. But this is something that the FDA, the CDC, and we are going to continue to monitor closely. There are processes in place where if there are any adverse reactions, health providers know how to report those adverse reactions. But also with new with these vaccines is every individual who gets a vaccine is going to get information to a network called vSafe, and they'll be asked questions to report if they've had any adverse effects of the vaccine, so that FDA and CDC can continue to monitor very closely for any potential side effects. We talked about this a little bit before. We are in phase 1A. Since we only have limited amounts of vaccine, less than 9,000 this week that we're starting with, it's really important that we prioritize we get it to the people who most need it. And we know everyone needs it, but we need to protect our healthcare system. As the governor's talked about, as our hospitals are surging, staff shortage from staff who are either COVID positive or in quarantine has been a real problem for our healthcare system. And so our healthcare heroes who've been on the front line of this, really, putting themselves at risk for COVID, are the first to get vaccinated, and we're excited to be able to protect them in that way. Same with EMS providers. And as we have seen, sadly, in our state, that staff and residents of long-term care have been at very high risk of COVID-19. They are also in phase 1A and will begin their vaccination program, some this week even. So these were decisions that were made based on that federal ACIP committee, as well as our own ethics committee. For 1B, ACIP has still not finalized their recommendations, and our ethics committee has not finalized their recommendations either. But we're looking at high-risk individuals, those who are most likely to be hospitalized or to die. So those with significant underlying health conditions, especially those over 65, are going to be important, but also essential critical infrastructure workers like poultry, education, like teachers and childcare workers. Others on the front line working with the public will be in 1B. And then we'll roll into phases 2 and 3 and 4 about 3 months or so from now. And we'll continue to add more detail about who fits in those categories as this vaccine initiative rolls out. So on the next slide, I just want to make sure that everyone knows that we have a lot of information on our website, de.gov/COVID vaccine. We continue to add new information every day for providers and for the public about the vaccines. That's the best place to go to find Delaware specific information about the vaccines, but also for individuals who have questions. You can email your questions to vaccine@delaware.gov and someone will get back to you. Now let me shift gears to another really exciting step forward in this fight against COVID-19, which is an effective treatment called monoclonal antibodies, which just a lot of people don't know about yet, but they have begun arriving in our state over the last few weeks. And our hospitals have begun to administer these monoclonal antibodies to individuals. So let's first talk a little bit about what they are. Monoclonal antibodies are man-made, and they're man-made to specifically work against COVID-19 virus, and they neutralize, or they essentially dismantle the virus to prevent the progression of the disease. Now, these antibodies are given by IV, so they have to be given at special sites, places where it's okay for people who are COVID-19 positive to come and to get an infusion, an IV infusion, which takes an hour, and then individuals are monitored afterwards. The side effects are extremely minimal. These antibody treatments are very well tolerated. What's important, as the governor already mentioned, they are most effective when they're given early. So ideally, they be given within 72 hours of the development of symptoms. And that's why if you're over 65 and you start to develop symptoms, or you think you might have COVID-19, talk to your doctor immediately. Get yourself tested so you can get a referral to get this treatment. So on the next slide, let's talk about who should get it. Now, the FDA is pretty clear about who qualifies for this, but essentially it's the same group of people who are at high risk for COVID-19 consequences, but especially those over age 65. So if you've already been considering yourself at high risk for COVID, and you're concerned, or you have COVID-19, you think you have COVID-19, talk to your doctor. If you haven't been tested, if they can do a rapid test, that's ideal. Again, the sooner you know, the better. and then get yourself referred to an infusion site so you can get this treatment. Now, people only qualify if they've had a positive test within the last 10 days, and also if they have mild to moderate symptoms. So if you are already sick enough to be hospitalized or on oxygen, you don't qualify for this treatment. In fact, it is felt that it could have adverse reactions. So again, that's why it's so important to get it early on in the infectious period for people. So our hospitals in Delaware, they stepped right up when they found out that this treatment was coming. We've got Bay Health BB, Christiana Care, Tidal Health Nanacoke, and the Wilmington's Veterans Association that have already begun operating infusion clinics, and our other hospitals are soon to follow. So again, just make sure if you think you might qualify, you talk to your doctor, you get yourself referred to one of these sites so you can get a monoclonal antibody treatment as soon as possible if you qualify. So I think that is it for me, and I'm going to hand it back to the governor.
Thank you very much, Dr. Rattay. Some concerning news, obviously, with the continued spread of the virus and the increase in the number of positive cases, but really good news in terms of the arrival of the vaccine here in our state. The first healthcare workers, hospital workers being receiving those vaccines, and then monoclonal antibodies as a way of treating particularly those most vulnerable populations and helping us manage hospital capacity and the inpatient census there. So a part of our overall response has been and continues to be our testing operation. AJ Schall has been our point person, working with many partners, including Newcastle County and others, to test in incredible levels now, numbers. AJ, tell us a little bit about what you're doing and what's coming.
Thank you, sir, and happy to be here again virtually with everybody. So testing continues to be strong. I think it's been a success story with this over the last several months with the partnerships with National Guard, Newcastle County, Public Health, the hospitals, and others. So this week, our testing remains strong. We have 24 sites across the state. That does not include the static sites at Walgreens and state service centers. We're also going to be adding 4 additional Walgreens starting tomorrow and another 4 later on in this week. So bringing that total up with the 8 additional ones this week. So again, we know there has to be multiple ways to get tested and increase that access for people. So that was one of the things we've been pushing hard to make sure we have a more constant and appointment flow type process. So Newcastle County has just over a dozen sites. We are closely monitoring the weather tomorrow, and I'll talk about that at the end. There will be a change for the 2 sites Newcastle County has tomorrow. Middletown High School will be going indoors from, I believe, 9 to 2 is the updated time, and their walk-up site will also be moving a little bit earlier. So we're sending out email notices to anybody that's been registered for those events. Kent County, we will have additional sites as well this week. We have 4 scheduled right now, working on our schedule for next week. Remember, we still have two Walgreens as well. There's going to be a Walgreens in Camden opening up as well at the end of this week. And Sussex County, we're down there today. We'll be there the rest of the week as well for different sites. So a lot of opportunities to get tested. We are still not trying to turn anybody away. You know, even if you don't have a reservation, if you show up on time, we're able to complete your test before we send it away to the labs. That's kind of our litmus test. We did run out of tests at one site last week, so we did apologize for that, but are reaching out to people to make sure they were aware of other locations they could go to get tested that same day or the next day. So again, last week was kind of their high watermark, 52,000 tests over the course of 1 week. That's the good news. The bad news is we are seeing the turnaround time at the labs increase. They become more stable. Right now for our curative tests, we're about 62 hours for an average time from the time the sample's taken to the email is sent out. It's now below 60. So just over the last 3 days, we've seen that come down. And we expect that to come down a little bit each day this week is we did some strategic scheduling with our partners at Curative to make sure we didn't overburden them. We are taking the trailers offline for a day just to rest, but we'll make up that quantity at other events. We also know that, as the governor said, we want people to be safe over the holidays. We want to make sure we don't see a spike in cases post the holidays. So if you are going to be visiting with family and you are quarantining now and you want to get an at-home test, probably order it today or tomorrow. If you order it today or tomorrow, you could have it by Thursday at the latest, turn it around, get it to UPS Friday, have your results early next week, and continue your quarantine through the holidays. Process is easy, hasn't changed. Just the three things you need: live or work in Delaware, an email address for each individual that's going to test. So if I'm testing myself and my two boys, I'm going to have to use a different email address. The system only registers one test per user at a time. A little bit different than Curative. And then you need a smartphone or a tablet to do a Zoom session with the medical personnel to observe you doing the test. So again, get your request into us by today or tomorrow, and then authenticate it with Vault by Wednesday night, Thursday morning, and you should be good to have your results next week. They are still averaging 24 hours from the time the test gets to them. So if you drop it off at a UPS drop box today, they get it tomorrow, probably late morning. You'll have that by Thursday at the latest. So up next, so we talked about what we're going to do to, really push the envelope before Christmas as much as we can, as well as going back to the governor's points that we met with Dr. Birch last week, and what can we do to become a little bit more focused on our testing. So Dr. Pescatore, who, if you've watched any of these press conferences, has been involved in several discussions about testing, is finally getting to see the fruits of his labor. So we're going to start testing rapid antigen testing next week. We're going to do at least 2 events, if not 3. We'll probably do these concurrent with other Curative events to, be able to handle additional people, but also be able to respond with the results at the same time. We are also going to be targeting the 2 groups that we think are at the highest risk. So those over the age of 65, because as Dr. Rattay mentioned, if you find out you're positive, you can talk to your primary care physician and get the needed treatment or therapy or medical advice needed. And then we also know that there's a lot of asymptomatic adults, that 18 to 35 range or thereabouts, that may be carrying this, giving it to family and friends. So we want to make sure we're able to turn around and give them guidance as soon as possible. So that works well, because right now with seeing a little longer increase in turnaround times, if we're able to provide some people with a rapid result, that should help them in preparing and communicating with any potential exposures. As we do this the antigen testing, anybody that is positive will also do a PCR just to confirm it as well. So remember, a lot of testing opportunities that are out there. DE.gov/get-tested has everything that the state's doing, Newcastle County, and of course, there's a lot of stuff that your primary care is doing. Walk-in clinics are doing testing as well. So there are options out there, and I'm sure we're going to see more in the coming weeks, as well as some new avenues just got approved. So I'm going to switch gears a little bit, go back to what I talked about quickly when we were talking about tomorrow's event. So we are expecting a nor'easter. Why wouldn't we not finish 2020 with an early snowstorm? And again, this looks like one of those events that's going to stick very closely to the 95 corridor. It looks to be a afternoon event into tomorrow night. And if northern Newcastle County is going to be kind of the area of the most concern, we will make sure we adjust and communicate for any testing changes, but we also want to make sure people are aware they should expect to have some difficult driving conditions during the PM commute. And we also have to be at the lookout. This could shift a little bit north, a little bit south, and we could either luck out, or we could see some of the snow and accumulations coming a little bit farther south. But we continue to work with our partners in Newcastle County, DelDOT and others. I know they're prepared. Again, we're expecting probably the main impact to be north of that 95 corridor. Newcastle County will get a few inches south of there as well, and then a little bit less as you go further south. We're also watching some coastal impacts with this nor'easter as well. So, Governor, I guess what's 2020 without leaving it with a bang, huh?
Well, we could do without this maybe major nor'easter, AJ, as we continue to respond to COVID-19. Obviously, some really good news out there, but the top, first of all, before we get to the top message lines, remember, for those of you who have not downloaded COVID Alert DE, an app that goes on your iPhone, enables you to be alerted if you've come in contact with somebody who's also participates anonymously, and let you know whether you've been potentially exposed to COVID-19, and you can take appropriate action. So think about downloading the COVID Alert on your phone. We still need more people to sign up there. If you haven't gotten your flu shot, make sure you get your flu shot. Obviously, I think the fact that people are wearing masks pretty significantly this fall has meant that we haven't seen as much flu. Dr. Rattay, you're shaking your head. That's actually a good thing, unintended consequence, I guess, or maybe an intended consequence, but all good news. So the main headline here, two headlines. We still have a very serious situation with the prevalence of COVID-19 in communities across Delaware. We're seeing a surge just about everywhere. It's been particularly high in Kent County. So we would recommend everybody in Kent County to avail themselves of the testing opportunities that are there. You can get that on the website. It was part of AJ's presentation. We just need to be careful, particularly over these holidays. Stay at home, no mixing of households. If we could really lean into these protective measures over the next couple weeks into the new year, then 2021, we've got vaccinations coming. We have better treatment. And those are other parts, important parts of the messages today. If you are part of that vulnerable population among our senior citizens, those who have pre-existing health conditions, know about the availability of monoclonal antibody treatment. And if you need to make sure you get tested as soon as you experience flu-like symptoms, so you can get the treatment sooner rather than later. As Dr. Rattay mentioned, it's more effective the sooner that you get it. And it also helps us, particularly for those vulnerable populations, to preserve hospital capacity. Came to us recommended by Dr. Birx, something that's hospitals are doing now in our state to try to preserve hospital capacity, which is a primary focus for all of us. And then finally, vaccinations. The heavy artillery has arrived. It'll take us weeks and months to get our population vaccinated, starting with hospital workers, healthcare providers, first responders, and all those populations of essential workers. So pay attention to the availability at your employment center and near you, and where you fall in that priority line. And the more people that get vaccinated, the better off we'll be in terms of preventing the spread of the virus in our state. So again, thank you all for joining us. Act with a sense of community now over the next several weeks. Wear a mask, most important thing you can do. Keep your appropriate social distance. Make sure you're sanitizing your hands when you're coming and going. Get tested periodically, and particularly if you've been inside with folks without mask wearing and in social settings in particular, and protect your neighbors. So with that, I know we have a number of people who've joined us on this Zoom call, and we would entertain any questions that you have.
All right, first we will go to Amy Cherry at WDEL.
Hi, Governor. I'm wondering when you may be getting the COVID-19 vaccine.
Well, I'm not in the first group. I can tell you that. I would take, this is one of those matters similar to when we talked about elections, that most of the election work was done by staff, so that if I was up for election, it wouldn't be perceived by anyone as interfering with the election. And I'll let the public health officials identify the priority. Obviously, but there is a role for me in setting an example, and if that's appropriate at a particular time, that I will do that. I think we need to get some experience with how people are, how receptive folks are being to the virus. I'm certainly not going to jump in line in front of healthcare workers or hospital providers.
Thank you.
All right, next we'll go to Tim Mastro from Delaware State News.
Hello again, Governor.
Hello, Tim.
I have two questions. The first one is on the new curfew for bars and restaurants. Just wondering how you ended up at 10 p.m. What was the reasoning behind that as opposed to maybe 8 p.m. or 9 p.m. or midnight or anything like that?
Yeah, it was mostly looking at the experience in those facilities, you know, the idea of providing some capacity for restaurants to serve their clientele, to get some revenue on the business side as well as on the protection side. We know that as the night goes on, people have more to drink. They get less attentive to public health protections and gathering closer together, not wearing masks. We know that these are venues of concern. And so, and we looked at other states, what they were doing and came up with 10 o'clock as the start of that curfew.
Mm-hmm.
So a mixture of the public health science and basically common sense with
Similarly, as opposed to just registration, will they be free kind of as how the curative sites work or anything like that?
Yeah, I'll let AJ or Dr. Rattay address that question.
So no, hey, Tim, thank you. They will be free. We are going to mirror them right now with some of our curative sites to help just get people through the process faster. There is a little bit different process with data collection. So we'll have people fill out a paper form. We might even put it online, let them kind of pre-fill out a printable PDF, bring that with them to speed it up. So it's a little bit more cumbersome, but I think we're going to work on to see how we can expedite that. So that's why we're kind of starting small, doing the crawl, walk, run with this. But we really think it could be a game changer with the rapid results if we go after the right populations with it. Not sure if Dr. Tay wants to add anything else.
And we also, Tim, talked about incentivizing people to get tested because the idea here is a preventive measure. We know from Dr. Birx and public health officials that a lot of the spread is what they call asymptomatic, i.e. from people that don't have symptoms, don't know they're carrying the virus. And so if we can get them tested, the evidence suggests that they are willing to quarantine, and that's a good thing. So that's the whole purpose here, is to protect others.
Sounds good. Thank you.
All right, next we will go to Brandon Holbeck from the News Journal.
Hello. A lot of the messaging before Thanksgiving was around avoiding big gatherings with your family or friends to avoid spreading the virus further. Now you've started to talk a little bit more about how if people are going to gather, how they can do so safely. Is that, or are there any other differences in the messaging or what you're doing now ahead of the winter holidays that you think will yield a different result, knowing that we saw a big spike in cases and hospitalizations after Thanksgiving?
Yeah, no, I don't think it's a change, maybe a recognition that people are going to gather, and so to really emphasize that it's very risky and the need to be careful, to keep distant, maybe to wear a mask in your own household, particularly if there are other households that are present as well. We still recommend avoiding that, but obviously the recognition that this is a special time of the year. My advice is just like, we know how special it is, but let's think about the situation that we have on the ground. Let's get to January. Let's get to 2021. The vaccine is here, and better days are ahead.
Giving it advice kind of along that line, is there a drop dead point where you would say even if you do quarantine, it would no longer be effective for you to mitigate risk heading into, let's say, Christmas Day. Like if you wanted to meet with someone on Christmas Day, is there a certain kind of drop dead date that you would need to start a quarantine by for that to be an effective strategy?
Yeah, so Dr. Rattay is best to answer that. We have, I think, changed our advice there, adopted, or in the process of adopting the new CDC guidelines there that shorten that period of time. I will say that in our conversations with the hospitals, they have adopted that new guidance, and it's been very helpful with their staffing needs. Dr. Rattay?
Yeah, it's a great question, Brandon, because the quarantine guidance has changed. And what we know about the incubation period is that most people become positive within 10 days of exposure. Today really is the drop dead date, if you will. There's 10 days now between now and the time that many people come together. So I want to reiterate what the governor said, that we really do recommend not gathering with individuals outside of their household. We've seen from our own data, from our case investigations, we saw so many cases and really super spreader events from people coming together on Thanksgiving. We know people want to come together, and we sympathize with how difficult this is when people want to be connected. But a lot of infection was spread over the Thanksgiving holiday. So our first message by far is, please just hold off this year and only spend time with those in your household. But if you are not going to listen to that warning, now's the time to start quarantining. As AJ said about the home test, now's a good time to get that test. And I would suggest that really you get yourself tested on, probably drop it in UPS on December 22nd or so that you can get the results back before coming together with your loved ones.
Thank you.
Thanks, Brandon.
All right, last we'll go to Nicholas Cialino from Delaware Public Media.
Hi, everyone. I'm just wondering if you'll offer a little bit more of the state's messaging around the vaccine, particularly for people who might be skeptical about it, especially considering how quickly it was run through the process and released to the public.
Well, yeah, Dr. Rattay is the best to answer that, but the nation's expert on these issues, Dr. Fauci, has been very strongly saying that the vaccines are safe, has gone through the process through which they were approved, the transparency and all of that, and the science that went into that. And obviously, he's one of the most respected voices in our country. Dr. Rattay?
Yeah, it really is a great question. And you may recall in the summer, we talked about this when there were suggestions that corners might be cut to make it available. And we even said we don't want to make it available to Delawareans if we don't feel that it's a safe vaccine. And I think this is part of why we are so excited about it, because no corners were cut. We have watched very closely with the rigorous reviews that have taken place under the FDA and CDC's ACIP. The studies that were done involved for this vaccine over 40,000 people. So they actually had more study participants than oftentimes. For those who began the phase 1 trials early, many months ago, they've already been monitored for several months for safety and any side effects. And, bottom line is the effectiveness of this vaccine, it exceeds our expectations, 94% effective, and it's safe. It is well tolerated. So I get there may be skeptics, but I think what we're hearing is most people are really excited and want this vaccine.
And we're also hearing from our hospital partners that the response that they've gotten so far from their employees, who are the first cadre of folks to be vaccinated, has been very positive, and that's certainly very encouraging. So any more questions?
One more. Is there any particular, I guess, inoculation rate you'd want to see in the population coupled with a certain amount of drop in cases when you would consider opening things back up? What sort of metrics are you looking for? I guess I'd ask.
Well, the first thing we're looking for is a flattening out of the curve. With respect to vaccinations, I think that's a question for Dr. Rattay, but we'll be looking, that's kind of one of the major messages here. The arrival of the vaccine is really, really good news, but it's not the solution in the short term to the surge that we're seeing. And that's why people have to be more vigilant, more careful over the holidays to follow the public health guidance here to limit the risk of exposure. There's a lot of virus out there. There are a lot of people that are testing positive and then shedding the virus in the community and to others. And so we really have to lean into that over the next several weeks, maybe month or more, to make sure that we flatten that curve, protect our most vulnerable populations, protect that hospital capacity, so that we can get to a point where the vaccination will really solve the problem. Dr. Rattay?
Yeah, I mean, that's a really great question. And experts are debating whether herd immunity is when you get 70% of your population vaccinated or 80% of your population vaccinated. But, we're looking at, approximately 700,000 to 800,000 Delawareans that we want to get vaccinated before we feel like we have herd immunity here. So, it's a massive undertaking, the numbers of Delawareans that we want to get vaccinated before we're in a place where we feel that we've got more control over this virus. But in regards to the metrics themselves, I want to point out that, as vaccine gets administered, we're going to be presenting vaccine-related metrics up on My Healthy Community so people can watch with us. And our goal is to take advantage of every single vaccine that hits our state so that, as soon as we get it into people's arms as quickly as possible.
Thank you, Nick.
All right, we just have one pre-submitted question that has not already been covered. This is from Susan Canfora at Coastal Point. She asks, concerning the very low temperature at which the vaccine must be kept, will it be warmed to body temperature before being injected? If not, does that ultra cold vaccine going into the bloodstream hurt or burn due to extreme cold?
Dr. Rattay?
Yes, Governor, I'll take that one. So the vaccine needs to be brought to room temperature. It needs to be thawed to room temperature before it's administered. That doesn't take that long. So once it gets pulled out of the ultra cold unit, it takes about 30 minutes for it to be at room temperature, and then it can be administered. And it does not cause burning or stinging when it's administered. It's administered at room temperature.
So thank you very much to all the media who have joined us today. And thank you to all of you who've joined us online as you have on a weekly basis. We appreciate your attention. We've reached a critical stage in our response to COVID-19 in our state, where we're seeing the biggest surge that we've seen over the last 9 months. It's a result of social and congregate gatherings over the kind of Halloween, Thanksgiving period as people moved back inside from the summer months. And we're seeing what public health experts expected to be seen in a surge. Very worried and concerned about a surge on top of a surge as we celebrate the Christmas holidays later this month, as we're into Hanukkah right now. And again, knowing that people are going to come together, and we would advise them, but not to do that. If you're mixing households, to do it very carefully, to be very conscious of the social settings in which you find yourself when you're out. We have a stay-at-home advisory, and we would bring that to your attention. Please limit any kinds of trips out of your home, again, to potentially expose yourself, making sure if you're going to the grocery store to get food or to a doctor's appointment, you kind of make those trips together at one trip and try to avoid as many exposures as you can. We can get through this if we can lean into those protective measures this month and the month of December and into January, because we still know that the winter months are colder days are ahead, and there'll be more times we'll be indoors with one another, and obviously that's increases the risk. The vaccine is here, and that's really good news. We have treatment for our vulnerable senior population in monoclonal antibodies, and would recommend to you to make sure that you contact your physician if you have those flu-like symptoms to get tested so that you can get that treatment quickly, because we know that that's when it's most effective. So again, thank you for joining us today. Those of you who are in Kent County, remember we need you to avail yourself of those testing sites that we have this week and in the weeks ahead. Thanks very much. We look forward to seeing you next week.